Okay, so we're gonna talk now about the record keeping, documentation, and record retention for the controlled substance. Now see here, the first point is telling you record keeping. How will you keep the record for this substance? Like so, the pharmacy is required to maintain a log or file of dispensed prescription. Each prescription need to be kept for the minimum of 2 years. I already told you this 2 year you have to keep that prescriptions. Have to. So authorities of Board of Pharmacy need to be able to review and inspect the log or file of a record at any time. They can come any time or any month, and they're gonna check it how much you sell and how much you ordered, and they're gonna check you and they're gonna ask you if something is misplaced. So keep in mind you have to place your prescriptions up to 2 years. Now see here, the log or record of dispensed medication should contain the following informations: date the medication was dispensed, detail of prescription, drug name, strength, and dose form. Okay, what are there in the prescriptions? There is the name of medications and drug names, strength, and dose form, patient's name, quality of medication dispensed, how many, quantity, and patient's address. Also you can find it over there in the prescriptions later. So it is important to note that the schedule 2 medication prescription need to have their own file. Now see here, I told you like in the case of schedule 1 actually is not used for the medical purpose, that is the street drug. So which drug you can find it on the pharmacies is schedule 2 drug. Okay, and schedule 2 drug is super sensitive. So what we do, we gonna make self for the schedule 2 drugs. Okay, always keep further schedule 2 drugs, and you need to place schedule 3 to 5 drugs at one sections. So this one is a sensitive, that's why you don't have to misplaced or don't have to like do something for that one. So like you need to place it on oneself for that one, separate it. And schedule 3 to 5 prescription need to have their own separate file. So while you are so you can see here, so additional prescription medication that are not controlled substance should also have their own file. So obviously we have to create a file. Okay, so the first file you need to create for the sensitive drug, that is called schedule 2, and the second file you're gonna make for the schedule 3 to 5, and obviously which is expensive or must sellable things, you need to make another profile. So you have a total 3 file actually on your pharmacy computer. So that's how you're gonna separate to prevent any kind of error. Okay, so especially you don't have to do any error on schedule 2, keep in mind that. So now see here, so now we're gonna talk about documentation of prescriptions and inventory. So uh, in order to consider legal and valid all controlled substance, prescription must contain the following informations. So while some doctor prescribe you, or like if they prescribe, then in the prescription it have to be written like this one. So the first thing, it's gonna be look like patient's full name and address, the date of prescriptions was written, prescriber DA number, name and address. You can see here even the doctor name and address have to be there, name of the drugs, dose form, strength and prescribed drug, the name of drug, prescribed quantity, how many it's prescribed, descriptions for the taking the medications, the number of authorized refill, if any. Actually most of time they don't give the refills. Okay, because people they change the numbers and they make a problem for the scheduled drugs. It might be given for only 1 month or and they recognize who is severely needed. Like some people's who are in the hospital cares, they need a painkiller, right? That is a codeine. So at that time we can like give some, we can give a refill for them, but maximum time for this drug there is a no refill. Okay, that's the exception case. And signature of prescriber, see here in the in this one, handwritten for the paper person or e-signature if sent electronically. If it is not signed, you don't sell that drug. Okay, never give the that drug. You need to call the prescriber. There is a number of prescriber, you need to call them and tell them, hey, you didn't sign, so you need to sign that form and you need to send it, tell the person you need to sign that one, and only then only you're gonna provide it. Okay,
Mhm.
so signature is more important, and the other thing can be changed, like the name of the drug you can change by the phone. If the doctor is telling, then you can change the quantity, you can change, but the signature, it have to be signature by that person's. Okay, so like uh, I just wanna include uh, so so you so let's allow change to the schedule to prescription from the prescriber to the pharmacist over the phone include. So this section is telling you, like I told you, this schedule 2, actually schedule 1 is not available in the market. So just don't worry about that one while you are working, but for the exam you need to remember that. So schedule 2 is a sensitive drug. So in that situations, if something wrong happen, so what will change by calling the doctor, and this is done by not by you, it's gonna be done by pharmacist. So you can see here, the dose form can change from the capsule to tablet or vice versa. The dose, it might be a capsules or it might be a tablet. Okay, medication strength, if it is 200 or if it is 300, they can change it. Amount of medications prescribed, how much amount, 1 2 3 4 5 6, they can change it with the phone. Direction for taking the medications, they can change, they can change it by the phone. If the doctor is calling and telling the pharmacist, hey, you need to, I just make a mistake, can you change these things, number one, two, three sections, four, they can change from the phone. But there is a certain thing the doctor can't change on the phone, that I already told you. The first things, they can't change their signature, right? So now see here, the first point, they can't change it on the phone. The patient name or spelling, other changes. If the patient is name is John Smith, it have to be he have like that one. It's never gonna be changed on the phone. Okay, and if they want to change, they need to fill the form again back. So a different control substance from what was originally prescribed. So if it is prescribed oxycodone, then they have to give the oxycodone. They can't change this on the phone by calling the pharmacist and prescriber signature. So how many things we can't change under the phone? The first is name of patients and control substance, name of controls drug, and prescriber signature. So keep in mind these things. Okay. So if any these changes are required, the patient must take the prescription back to the prescriber to obtain the new or corrected prescriptions. They have to for this three situation. But if there is a minor mistakes like a medication strength 500, 200, and the quantity that you can take, you can call them. It is done by the pharmacist and they can change for you, for the patients especially. Now see here is a verbal or faxed order for the Schedule 2 medications. Here is some sensitive things we have to learn now. So in order to Schedule 2 medication prescription to be faxed, the patient must meet one of the following specific requirement. Okay. First of all, reside in long-term care facilities. See here, When the pharmacy can accept this prescription even with the faxed or verbal response. It's telling us if the situation is for the patients, if it is really terminally ill at that time, they can use these things. uh, they can use verbal by calling the pharmacy, and they will send you actually a drug even with the fax. But in the case, if this case is not there, then they have to send by the doctor, and they have to, or electronically, or otherwise they have to take the prescription paper to the pharmacy desk. Now see here, the first thing, we can accept verbal call or faxed. First is reside in long-term care facilities. Those person who is terminally ill, and just imagine some people is old age and they are having so many diseases like kidney failures in the stage. At that time, we can accept the prescription for the Schedule 2 drug. Otherwise, not okay. Reside in community-based care. If it is just say staying with on hospice cares or community-based cares, or practicing a hospice program as a patients. Like, what do you mean by hospice program? Hospice is denotions of the person is a in the stage of life. Okay, they are not treated to live, they are just treated to having good time actually, because the doctor is already telling that this is the end stage of life. And so at that time, we have to just minimize the pain actually. That's why we recommend them oxycodons, some drugs which is really helpful to prevent, like leukemia is a really painful disease, right? The bone pain is really bad, and there is a lot of disease like that, renal failures. So that situation, that is called hospice. And see here, receiver of a compounded home infused IV pain therapy. If the person is home and he is just staying home and in a IV, that time we can accept the verbal or faxed order for the medication too. So this condition to follow these instructions. Keep in mind. The signature of prescriber must be on the fax prescriptions, and the fax will serve as the purported prescription document. Only in emergency situations are a verbal order for the Schedule 2 medications recognized. The quantity of medication dispensed is confined to the amount needed in the emergency situations. And now see here, in this situation, what you have to do if you are calling the pharmacy and